Sponsored locally by TVFCU.
There's a good chance that an awful lot of you watching this morning, perhaps yourself or someone you know, struggles with AFIB. It's become a more common cardiovascular diagnosis than I think we've seen in the past. This is Dr. Sam Jones, who is here with CHI Memorial, and we're talking this morning about electrophysiology cardiology, which is your specialty. Do I have that right?
You do.
I jokingly said to you, we'll go to medical school in 6 or 7 minutes. So correct me right off the bat. But I think I'm right that AFIB has become on the rise in terms of a diagnosis.
Absolutely. Yeah, atrial fibrillation is something that we're seeing increasingly because our patients are just getting older. And with that comes a lot of good things, wisdom, but unfortunately some bad things like some abnormal heart rhythms. And we know that atrial fibrillation being the most common abnormal rhythm, it is something we really need to make sure that we learn about because there's a 5 times chance of stroke if you have atrial fibrillation.
Oh, wow.
And a 3 times chance of heart failure. So it's important that we find this out so that we can start treating patients, if we can start giving them blood thinners or medicines to help control the heart rate, control their symptoms. So it is something that we are really trying to focus on more and more.
So quite literally, is that reason for the increased risk of stroke because the blood flow is not regulated, so to speak, and so that puts you at greater risk?
Exactly. Well, you're getting medical school right off the bat. Because the top chamber of the heart, the atrium, is just quivering. Blood flow does not go through the heart very well, and because of that, blood clots can form. So it's critical that we identify these patients and we treat them with blood thinners to reduce that stroke, which can be very effective.
Okay, so now people are saying, gee, Julie, get to this little prop that he has in his hand. It is not some little prop. You're very proud of this. This is called a pulse field ablation. Is that right?
It is, yeah. And so when we think about ways to treat atrial fibrillation, the first thing I would say is that there's a lot of different ways to treat it, and for what is right for one person may be different from someone else, and that's why it's important to go to the doctor and find it out. Sometimes patients need medicines, sometimes they may need a shock of the heart, sometimes they may need to focus on lifestyle. But the one thing, as you mentioned, is an ablation catheter. We've been doing ablations now for some time. We've been doing this for over 25 years, and it's a very effective tool, and I think we've gotten better and better over the years. Every 5 years, something comes new. This is the new thing that we have called pulse field ablation, and it's just a different way of ablating the heart so that we use very rapid pulses of electrical energy that are able to ablate the heart. What it just means is that it finds the triggers of the abnormal electrical energy. We use this by going into the vein of the leg, all the way up to the heart. The patient's completely asleep during this so that they're very comfortable. And we identify those areas of the heart. We're able to maneuver this in different configurations, but we find those triggers of the heart. What's causing the problem? We get right to the root of it. And then using ablation, that just means that we get rid of those signals that are causing the issue.
So when you live with AFib, did those triggers, those causes shift with time? In other words, sometimes the way you're treating an AFib situation today, in a year or two, it could be a different need?
That's a great question. And I think that one of the things we've learned over time is that the earlier we treat atrial fibrillation, the better outcome we have. Many years ago, we would let patients continually go down a road of more medicines, more shocks. But we know now if we ablate them sooner, we have a more aggressive approach, the chance of staying in normal rhythm is much better. And in the meantime, we're still trying to make sure that we tell them, do all the right things, all the things that your mom told you. Make sure that you're exercising well, making sure that you're maintaining your weight, low caffeine, low alcohol, all the things you need to do, control your blood pressure, control your diabetes. All those things are still critical. But in the meantime, a strategy of ablating earlier can be very helpful. And when we have a technology like pulse field ablation that has some benefits, we even think that may be even more effective for patients.
So I know I want to brag on you a little bit because you might not want to be the one to do the bragging, but once again, leading the charge, the hospital is the only one in the region offering this. Is that right?
It is. We were able to get this new energy source, and we're very excited. I think anytime you have a new technology that comes to the region and we can provide that to more patients, we think that this is another technology that we have. We don't work in isolation, though. We certainly work with our surgeons, and there's a lot of technologies that they have. We're still working with all of our interventional cardiologists, with some of our imaging cardiologists. It is a comprehensive care team that really approaches these atrial fibrillation patients.
So once you've done the ablation, if you've done it once, is there a maintenance procedure? Do you do it again?
The hope is that patients will stay in normal rhythm the rest of their life. The reality is atrial fibrillation is a very difficult procedure. It's a very difficult arrhythmia to take care of. And so I tell patients, it may be that you have to come back for this. We're trying to reduce the burden of this. Let's focus again on making sure we take care of the lifestyle things first. Go back to the basics. We may still need to do some medicines, but I think each patient is individual. We just have to make sure we're looking at each one to see what's right for them. They may have to have another procedure.
In case anybody makes an appointment to come and see you and then the procedure is necessary, will all patients benefit from the pulsed, or do you determine the best course for each individual patient?
Yeah, that's another good question, because the other ablation strategies that we've used, such as the thermal, the heating, or the cryo, which is the freezing, sometimes patients still need those. Those are appropriate for certain abnormal rhythms in certain patients.
Okay.
And I think it's just one of those discussions that you have with your electrophysiologist about what's right for me, and we have to decide that on each individual.
Well, let me show people how they can get in touch with you, and thank you for a little snippet of medical school this morning. It's Dr. Sam Jones. He is with the Chattanooga Heart Institute. They do have 7 locations around the area. Easiest thing is to call them, 697-2000, or go online, ChattanoogaHeart.com.
Don't miss Orange Days, Ashley's biggest sale of the year. This week only, shop incredible doorbusters like this queen panel bed starting at just $199. These savings won't last long. Shop and save today, only at Ashley.
Hi, I'm Jeff Wilson. I'm an energy efficiency expert. And if you've been living with a cold, drafty home with high energy bills, it's time you take a hard look at USA Premium Foam Insulation.
USA Insulation.
Look your best.
See your best.
Look your best.
See your best.
Look your best.
See your best.
Look your best.
See your best. Look your best
See your best.
at Eye Ear Optical.
The Purple Store.
Fish delish, fish delish. Crab cakes or shrimp or fish delish. Get pups and a side, each $5.99. Oh yeah. Captain D's fish delish.
Unexpected pregnancies are challenging and costly. Choices is here to help you with the services you need for free. Choices provides urine and blood pregnancy testing, ultrasounds, STD screening, abortion pill reversal, and after-abortion care. Our medical staff is here for you. If you are unsure about what to do during an unexpected pregnancy, call or text us at 423-892-0803.
Ashley's Orange Days are this week. For a limited time, buy more, save more with up to 30% off, or get low monthly payments with no interest financing for 60 months. And with our price match guarantee, you know you're getting the best deal. This week only at Ashley.
Okay, shorts weather is going to be here before you know it. Bathing suit season is around the corner, and your answers to a prayer are in the studio with us this morning. This is Caitlin Thomas. She is with European Wax Center. This is Kayla. She's going to be the model for the day. And I should say centers, because you have 2 locations now, right?
That's correct. Yes, ma'am.
So the Fraser Avenue one, and then you've recently opened Waterside Pavilion or whatever by Haverty's.
Yes,
off
ma'am.
of Shallowford
Off
Road.
of Shallowford Road. Yes, ma'am.
So I mentioned kind of the obvious things about short season and bathing suit season, but really you can do this for people all year round, Caitlin, because what you're going to demonstrate on Kayla today is an upper lip wax.
Yes,
is that
ma'am.
right?
Correct. Yes.
So this is beneficial how? What's the secret of this wax?
So the secret of this wax, it's a hard wax first of all. So the difference between a hard wax and a soft wax you would put the wax on and then use a fabric and then remove the hair. We skip the fabric part. So we just place this on, it hardens, and then we remove it.
Okay.
So it tends to only stick to the hair, not to the skin. So you're gonna get less irritation, a better wax, but the main thing is less irritation. It's gonna leave you less red, not remove skin, etc.
Y'all were very gracious when you came in the studio today and you let us set up here. Typically, somebody would be on a table,
Yes, ma'am. Correct.
lying down. So we were going to even do a chin on Kayla today, but then of course the wax would probably spill a little bit.
Right.
Is there any, when you do it to your face, is there any irritation? Like, should you plan on having a little bit of downtime before you go back to work?
Not necessarily, and that's really due to our 4-step process. We cleanse the skin, protect it, we wax, and then we rejuvenate it. So that rejuvenation step is what really kind of calms that redness down.
Okay.
Now, some people, if you're just naturally have more sensitive, irritated skin, you might see a little bit more, but outside of that, we never see it last more than maybe 5-10 minutes.
Okay,
So,
well, I hate to ask her to put it on you because your lipstick looks so pretty. But do you want to show us how it works? Because
Yes.
you said it doesn't take very long.
doesn't take long at all. Yes, we can go ahead with our 4-step process. We'll go ahead and start cleansing Kayla here.
So this process that you're talking about is really part of the key to it working?
Correct. Yes, ma'am. So part of it, as far as just removing all the hair and then reducing that irritation.
Okay.
So right now we're doing our first step, which is a little pre-wax cleanser.
Okay.
Then we're going to go into a little pre-wax oil. This just makes sure that the wax only adheres to the hair, not to the skin. Just kind of
Okay.
gives it a little protective layer there.
Makes sense.
Yes, ma'am. And then we're going to go in with our comfort wax. So again, this is exclusive to European Wax Center. So you can only find this exact formula with us.
Okay.
And the good thing is it's at a nice temperature. It's warm, but we're not burning anyone, right?
And I wish you could smell it. They're sick of hearing me say, I think I'm on my 8th time now to say how good it smells. There's lavender in there.
Yes, ma'am. A little bit of chamomile
Okay.
as well.
Okay. It glides on.
It does. It's beautiful. It works super duper well.
Yeah, I don't want your hair to get caught in it.
I'm gonna have to cross over just a little bit
Oh,
on Kayla.
you ripped it off like
Yes,
that fast.
and that's it. Yes, ma'am. It's super quick.
And then you do
Look
it on
at
the
that.
other side. You
Yeah,
would do it
and
on
then
the
we do it
other
on the other side. Do you want to do it on the other side? Yeah. Okay.
Well, she has to be balanced.
Yeah, she's got to be balanced.
So, okay, I'm going to stare at you like I'm your best friend. So there's a little bit of a line that you can see where I guess there had been hair there.
Yes, correct.
But it's not red at all.
No.
That would be very easy, I would think. Now, can you put makeup on over that after it's
You
been
can.
done?
Yes, you sure can.
So you could go back to work
You could
and
go back
nobody
to
would
work.
ever know.
The good thing is most of our guests do the lunch break wax. They know that we're going to be quick in and out, and they know that they can get right back to work immediately. Will you hand me that restoring serum right there and the other one, the white one. This
Okay.
one, sorry.
I told you I'd play band.
one.
Oh,
Sorry, friend.
I'm not going to get
I know, the
hired.
white one. Which white one? The other white one.
So, okay, I want to talk about a couple of things while I've got you. Well, you can
absolutely.
keep on doing
Okay,
your thing.
perfect.
One, if you've never done a European wax before, I think that this is accurate. You want to actually do repetitive treatments.
Correct.
But if you start now, before the summer weather gets here, the treatments last longer. Is that kind
Correct.
of right?
Yeah, so we say give it at least 3 to 4 consistent waxes. So we want you coming in when you first start once a month for about 3 to 4. Now after that third one, you're gonna start to see those really good results, which is what you're saying. If you start now, by the time summer comes, you're ready to go.
Which means that you might not have to shave your legs all summer.
Correct. Yes.
Can we say that again?
Yes.
You might not have to
Say
shave
it
your
loud,
legs all
yes.
summer. Now, y'all also have like memberships.
Yes, ma'am. We do have wax passes that we offer to our guests. Those range from you can buy 3, get 1 for free. You can buy 9, get 3 for free. It just depends on how long.
Kayla, in defense of her, she's not mic'd,
Right.
but she is kind of the one who's the expert in
She
those
is our expert with
memberships,
wax passes. Yes, ma'am.
which is why Caitlin was looking to her. Okay, I had mentioned to you that graduation season's here, Mother's Day's coming up, a great gift to give somebody, and then here you came with these little bags.
That's right, with the little bags. Yes, we have gift cards. Like I said, the wax passes, samples, etc.
So this was very fast.
Yes.
And you mentioned that a lot of women like to come in over a lunch break. So if you were having your legs done, for example, how long would you be there typically?
So 15 minutes, and that's from the time you walk in to the time you check out. So it's not necessarily 15 minutes of wax on your legs.
Now I
So-
got to tell you, I will try things on the show a lot, and my reaction is my reaction. I don't really hold back. So if I like it, it's obvious. If I don't like it, I typically make a face. You did not make a face.
Yeah, it's not bad at all.
It didn't hurt at all.
It's not bad.
How old do you have to be to do this?
So it depends on the body part. However, I mean, if we were just doing a lip, like some people start as young as 9, 10 years old. Just kind of depends, but of course, parental consent.
Do you I don't know this, but as we age, do the hairs on our face become more pronounced?
A little bit. It kind of, again, depends on the area. Like on the chin, you might start to see them get a little bit more coarse. They might turn gray, which of course gray hairs tend to be more coarse. And sometimes you have that vellus hair, which is just kind of that natural
little fuzz?
Yes, correct, yeah.
If you are removing it this way, then if it does decide that when it comes back naturally. It's not going to be a stubble.
Correct, yes, it's the exact same, yes. I mean, over time, the goal is to get it from that coarse hair to the vellus hair, right? But people ask that all the time. Is it going to come back coarse or super prickly? Not at all.
But that's important, I think, to stress.
Right.
Do you do like parties? Can you come as a group of people?
We have actually done that before, where we just kind of organize it, and let's say you have 10 people, we just kind of book everyone together.
Yeah,
and, you know, we'll
that'd
have
be
some
fun
cake.
for like a bachelorette thing or
we've
something.
Done it. Yes, we've done it several times
Ahead of the wedding. She would know to say that she's done it several times. You've been with them for 10 years?
Yes, ma'am. It was 10 years in December.
So I think that's very important to point out, because that means that you're experienced in what you're doing.
Yes, ma'am. Thank you.
All right, I'm going to let people then know how they can find you.
Yeah, absolutely.
When they opened the location on Lifestyle Way by Haverty's, which is their newest one, can I tell how many people you said came?
Yes, absolutely.
600 and something people.
In the first month.
In the
Yes,
first month. So word is out there for sure. There are the phone numbers. 785-8000 is Fraser Avenue. 269-8989 is the one in the Shallowford Road area. Just go to waxcenter.com.
Yes, ma'am.
Can you make an appointment online?
You sure can.
So fun. Gosh,
so
you
fun.
look good.
Thank you. She always.
Winter weather across the Tennessee Valley can be wild. Count on the Local 3 Storm Alert Team to prepare you for what's next. Local knowledge means accurate forecasts for where you live. Forecasts for your community, your life. Winter weather coverage to plan your life around.
Hey, Mr. Handyman. We heard that you can fix a lot, but then we had this little thought. You do jobs both big and small, but can you really do it all? Can you put a tire on my bike? Build a cabinet for my boots that hike?
Yeah, we can do that.
Can you assemble this so we can grill? Build a deck where we can chill?
We can do that.
Can you fix the tiles that need some grout? Hang the lights so light and pretty? Put a door in for my kitty? Wash my house squeaky clean? Build a fence so I'm not seen?
Yes, yes, yes. We can do all that. For all jobs, big and small. We do it all.
Next time on Mathis Court with Judge Mathis.
What did happen?
Well, the first night I could not sleep because of those sounds emerging from the bed. They were not relaxing, they were disturbing.
Weekdays at 2 here on Local 3.
Thanks so much for watching. Have a wonderful rest of your day. Tomorrow on the show, the Creative Discovery Museum is going to be here. So will the Chattanooga Symphony and Orchestra. They're gearing up for a fantastic performance that you're not going to want to miss. We're going to head over to Ringgold and pay a visit with Jesse Thornton Karate. They're part of the TVFCU Ideal grant and a wonderful story behind their area business. Have a great day. So glad you could join us for a little while this morning. We'll see you tomorrow.
Hi, I'm Susan, and I lost 27 pounds with Bragg Weight Loss in